But let's take it all the way to the extreme first and to the cell. And we've touched on some of this, but to get really zoned in on the cell, a body that is taking in too many carbs, blood glucose is high, insulin's ramping up, trying to get rid of that glucose out of the bloodstream. Take it to the cell and explain what's happening there as it becomes insulin resistant.
Absolutely. So when you look at the imagery that I try to paint for patients, it does, my team gets really mad at me for this, but I'll start with the mitochondria because it's the best part of the cell. It's super delicate. It is really critical for how your body takes energy, takes fuel and turns it into energy. How efficiently you do that will predict whether you're going to have memory as you age, cancer as you age, heart disease as you age. It is really this critical little micro morsel, micro vacuole in your cells. And as that mitochondria in a young baby or a child is growing and developing, you look at how efficiently it takes any fuel. And I'm talking about fat, glucose, or protein, which is really not a fuel, but we'll call it that just for simplicity. But as those elements of fuel cycle through a mitochondria, it produces moments of, it produces ATP. It produces units of energy at the end. How well it does that without wasting energy that's the secret sauce. That's what we're trying to improve in the people without healthy metabolisms. And that's what babies and children do really well, especially in those growth times. As long as nutrients is delivered and those mitochondria are as pristine as they're supposed to be, you will find just miracles of life happening right in front of you. But if you could look at that cell, it would not leak out any rogue energy. Now, they're hydrogen ions if you care that much, but they are also, they are places that your body needs to stop that little critter from bouncing around. A hydrogen ion that's not supposed to be that's supposed to be bound to something that is not bound to something. If it bounces around the inside of a cell, it breaks things. It's like the Tasmanian devil. It just destroys things. So we have mechanisms in place to capture that rogue energy. A healthy mitochondria does not let them leak out. It is very efficient at how it trades hydrogen on either sides of that internal membrane, and out the other side comes this beautiful thing called ATP. Okay, there you go. And your body resets and it does it over and over again. And as long as those mitochondria are not broken, you don't notice anything. And you probably don't notice the first few times you break a little seam in your mitochondria. But what's happening in that little seam that's broken is out leaks this energy that doesn't belong there. And your body's looking for anything to put a sponge on it, just like trap it. If there's a ketone around, you win. It is one of the best antioxidants, anti-rogue electron, anti-rogue hydrogens that is out there. And by golly, it's made right there in the mitochondria. So it's at the site of the problem. It's also a fuel if you want it to be, but it can also absorb that nasty little critter that will become your cancer, that will become your dementia. And in a cell that only burns glucose, glucose is our default fuel. It's what our body prefers to get rid of first. The reason this glucose insulin attention has, dominated the headlines in medicine is that without that balance, people die. And if you go back to the history books of what happens without insulin, the death of these children that didn't have insulin, it is heart-wrenching. You don't have to be a parent to feel the suffering of the parents watching their children just suffer because they could not get glucose into the cell. That's what insulin was doing when it's in the healthy zone. As you look at the space for what a ketone is doing, it also can go to the same place in the cell, but it only does that when glucose is low or when glucose is all used up. Because how do these kids die of ketoacidosis? The glucose in their cells is absent. They can't get it there, but the glucose in their blood circulation is rising to 400, 500, 700 milligrams per deciliter of glucose. And it just swells them from the inside out, and their brain swells and they die. It's like a concussion. the brain stem, the skull needs to have a crack in it, and it's a bone, so they die. That swelling happens from that much high blood glucose. So on a cellular level, when all we can burn is glucose, it is a life-saving event so that you don't end up with what those type 1 diabetics did in 1920 before insulin was on the market. And now in 2025, as you look at the abundance of glucose getting into our circulation, insulin says, okay, give that cell some, and then as soon as it's satisfied, we're going to store the rest in fat. So you've got a bunch of fat on the body, but inside that cell, it never sees a ketone. Why? Because you never drop the glucose low enough to spark that side of the metabolism. And so the danger of having that mitochondria only burn glucose is that it gets hot. It's like a motor that never gets a rest. It's the highest tax for that glucose molecule, and it happens over and over and over again. It vibrates with excess heat, and that's where the tearing happens. That's where the brakes happen. I mean, it is a engine that overheats. Think of a ketone as the oil. That if you said, wow, if I just added oil to this engine, it would cool it down. It would stop smoking with so much debris in that cell, which is the trash inside that demented patient came from that mitochondria only burned glucose. It only burned glucose, and insulin fed it. And now we have a bunch of trash in there, and we have mitochondria with holes in them. So they leak out hydrogen ions all over the place, and more things break than go right. And that is a cell that shows up in my internal medicine clinic, and they say, Doc, I just don't understand why my brain is foggy. I can't understand why this autoimmune disorder has riddled my skin, and it's falling off. It's not working right. Why my eyes don't work right. I mean, I can go through the list of what chronic diseases show up with metabolic disease, but I'm sure your audience probably has most of them, or has had, or knows people with them.
So to make sure I have this story correct so far, let me jump in for a sec here. It all starts with the mitochondria. We're providing too much glucose, which causes it to become leaky. And over time, waste builds up in the cell when there's all this breakage happening of the mitochondria and things aren't working properly. Talk about the part of the story where insulin ramps up in the bloodstream, trying to jam more glucose into that cell, that part of the story.
Right. So at first, when insulin is doing its healthy part of speaking to your cells, okay? Insulin gets a signal when you start to masticate, when you chew. So even if you put a little gum in your mouth, especially my insulin-resistant patients, insulin starts to say, all right, we got glucose coming in the circulation. And as long as insulin's present with that glucose, insulin causes these two straws, or they're straws, to go to the cell membrane. And anytime glucose is heavier on the outside of the cell than the inside of the cell, the glucose sucks through the straws and feeds the inside of the cell. That's how our bodies get energy. But that straw can only stay in the cell membrane when insulin is bound to the receptor, when it's telling the cell, hey, take in some of this glucose. And the first time insulin speaks to the cell, when you're a child or when you're in a growth spurt, it takes one insulin molecule to deliver that message. But it is like the boy that cried wolf. The insulin says, I need you to take some glucose, and the glucose out in the cell is pretty good. As soon as the glucose lowers just a little, the straws go away, and no glucose can get in. So the insulin gets a little more ornery. It says, I'll just speak louder to these cells, so your body makes more. And now your cells have learned that it takes 2 insulin to get those straws to go to the cell membrane and let those glucose molecules diffuse. I mean, there's no energy that's required. It just is a diffusion into the cell, as long as the straws are at that cell membrane. Now, months go by, maybe a year goes by, and your body says, good Lord, she's eating so much. The glucose is too high. I need this glucose to get lower quicker. I mean, we eat a meal and the glucose stays high for 3 hours. That's not healthy. We need it to go down within like 90 minutes would be a good marker. 2 hours is for sure it should be down. So now it makes 3 insulin molecules for every time you put 1 straw in the cell membrane. And you can see where I'm going here. That as time builds, the patient doesn't feel anything. There'll be times where they feel a little shaky when they didn't eat quick enough. That's because the inside of the cell was waiting for that third level of insulin to put the straw in the cell membrane so the glucose could slide into the cell and be used as fuel. And now you get to be 60, 55 years old, and it takes so much insulin. It is packed everywhere. You are making 10 times the insulin you should. You're making it at all hours of the day, even when you're sleeping, and your blood sugar still does not lower to healthy levels 10 hours after eating. That insulin resistance is where people get, well, they get stuck. They get pretty darn irritable and ornery. They wake up in the middle of the night and say, I have to have toast and milk in the middle of the night because my body requires it. No, your insulin's winning. You've trained your poor cells to require such a screaming match from insulin that they can't get fuel in the cell any other way. And this includes the brain. And ketones are not coming to the rescue. Why? Because insulin's high, and so is glucose. So what the heck do you need ketones for? Ketones come when those two go down. And now you've got trash building up everywhere. You've not taken out the trash in years. The insulin amount that's necessary is, quadruple or 10 times the dose. And there is no chance that if you went without food for 5 days, and I've had patients do this for 10 days, and they still didn't get blood sugars below 100. That's a terrible idea. Do not do that. They wasted a bunch of protein mass in that nightmare. They're metabolically broken. And resurrecting the other lever in their body of how do they mobilize the fat that they've stored for years. This is also the key ingredient that they're going to need in order to take out the trash. Taking out the trash has a fancy word called autophagy. It means that your body will recycle all that trash and turn it into something good, but it will not do it until the chemistry is right. And you got to have ketones around in order to induce autophagy.
All right, let me set the scene again. We have broken mitochondria. We have trash building up in the cells. We have blood glucose rising, insulin rising in the blood. Talk about outside of the cell, the problems with that insulin rising and blood glucose, and how this connects to chronic disease.
Right. So yeah, like I said at the beginning part, that insulin saved their life because they have enough to get it in the cell. But now that they make it all the time, morning, noon, and night, in excess, the baseline per of how much insulin comes out of your pancreas is 3 times at baseline, not even when you eat. And that insulin is a hormone. It talks to cells. And although it puts straws in the lining for glucose to get in, it also signals things to grow. It signals fat cells to grow, but it also signals that epithelial layer inside the lining of all your blood vessels. So if I was to look down the tunnel of your aorta, or the biggest artery in your body, you would see this beautiful skin lining if you were 10 years old. But it gets to be a little ruddy when insulin's been high for this long. The first thing insulin did to the inside of that blood vessel is you can't really see it when you look down that aorta, but there is a slime layer called a glycocalyx that lines every blood vessel when we're born. And when we every day of our life, we're trying to grow that glycocalyx. And it's what helps keep the trauma of circulating blood from hurting our blood vessels. So perfect design. That it's like an insulation, but it's invisible. It's a little protein. You can't see it. And when you watch how to replace it, the worst thing you can do is give it too much insulin. Insulin will kind of take those beautiful fingers that are flowing inside that blood vessel for protection, and they get shorter and shorter, like the beautiful carpet you have in a fancy house versus the carpet in a frat house where it's matted and down and they can't find a single little tendril there. That glycocalyx disappears. So when you start to see the first signs of what's happening on the inside of a blood vessel, it's got damage because your protection is gone. The next layer that happens is that endothelial layer starts to say, well, I'm going to protect myself. I'm going to make some lining of it. And that endothelium becomes thickened, and it also starts to store calcium in it for a host of other reasons. So that's what insulin would do on a chronic level to blood vessels. And let's talk about where those blood vessels are going. One of my top videos was to have a limp emoji of an eggnog of an eggplant on the thumbnail. And what I'm talking about is heart disease. And I'm saying that the blood vessels that run through your genitals are the same ones that run through your heart and your brain. And it really is a great teaching tool, because the blood vessels of why is there no hair on my toes? That's one of the other physical exam findings of insulin resistance, but also of vascular disease. That the nutrients to the hair follicles in your toes do not rank in the hierarchy of who needs the good stuff. And your body's going to leave that alone because the blood vessels are ruddy on the inside. They've got the missing glycocalyx. They started to thicken that endothelial lining, and little things start to happen, like the hair on your toes doesn't grow anymore, or the hair on the bottom part of your leg doesn't grow anymore. That you'll see, you can see forgetfulness, and you say, wow, is that because there's a tiny little blood vessel in your brain that got tied off? And if I did a MRI, I would see these lesions that you didn't notice because it was too small of a brain matter, that it didn't give you a big symptom. Maybe you had a headache that day. But the answer wouldn't be rush you to the hospital and give you anticoagulants. It's you got to restore the inside lining of those blood vessels. And that starts with lowering the amount of insulin. So the blood vessels go everywhere. So that's where we start to see disease in your heart and your liver and your kidneys and your bladder. I mean, every place you deliver blood, that's going to have an impact. It's not as efficient at getting the oxygen in and getting the nutrients in and removing the carbon dioxide and whatever other trash it gets to pull along. So step one, blood vessels, where they go. Next big part of what happens with insulin resistance is that the defense mechanism in your body, your immune system, is being crippled. That your immune cells, your white blood cells, change over every half an hour. You get a new crop that shows up, but within 4 days, you get a whole new session. So it's a really great system to say, boy, what's happening inside that rapidly dividing organ of the white blood cells? And when they don't handle infections as well, or the infection lingers for much longer than it should, or they have an error that the body has now found a part of your system that they think is the enemy. And so it starts to attack it. This is the premise of autoimmune disorders. And if that enemy happened to be a thyroid cell, it's a thyroid, it's Hashimoto's thyroiditis. Your immune system is attacking the thyroid. And it's an error. It's an error that happened months before when your white blood cells were trying to replicate perfectly. And then if they don't replicate perfectly, there's another couple of systems that will throw out the bad guys, throw out the lame duck that isn't going to do its job. But it isn't efficient anymore. Insulin stopped it from being efficient. It's making mistakes. It can't keep up with the mistakes. And that defect in cellular white blood cell production leads to a host of other immune systems. Call it, if the immune system attacks your blood vessels, we can call it lupus, or one of the arteritises. If it attacks your joints, we call it rheumatoid arthritis. If it attacks your colon, Crohn's disease, or ulcerative colitis. If it attacks the oligodendrites in your brain, we call it multiple sclerosis. And those are the deadly diseases of chronic disease that did not just show up when you got the diagnosis. They had been brewing for 20 years before that. How do I know? That development can be aborted. And in my career, I have told patients, you can't reverse these things. I have had to eat some humble pie saying, well, son of a gun, it's gone. I don't know what the heck happened, but keep doing what you're doing. And that doing what you're doing turned out to be, we had to restore the mitochondria inside their cells. We had to lower the amount of insulin their body was producing, and we had to give those cells many generations of healthy life cycles before that disease reversed. And what I'm here to say with confidence and with excitement is I've seen it thousands of times now, and so much that it is the footprint for what I try to teach in as many ways as I can without, losing my audience to the sciencey side of it. It does take a careful measurement of how well are you replicating those white blood cells for the next 30 years. And you can know that. You can check on that. The price you pay is if you've had an autoimmune disorder, you do a Google search, you're going to get more of them. They acquire. You get more of them as time goes on. To reverse them means you definitely have to stay away from that level of metabolism again, because if we get you healthy, it comes back really quick when you fall off the wagon. When that insulin rises again, they return. So the first thing we talked about was blood vessels. The second thing we talked about was white blood cells. Let's not miss that there are some amazing things that happen inside the human brain when we take away the excess insulin. The seizure disorders are the classic diagnosis linked to the ketogenic diet, but I contend that we should have been teaching how powerful the reversal of depression is when your brain uses two fuels. And if there's any reason that I push this, I have taken care of broken brains for 25 years. And the first sign of a broken brain is it's depression. It's inability to get over a season of disappointment or sadness, or even just of ill health that the brain just can't resurrect. And one of the fastest ways to do that is to give it a different fuel. Those first few steps of how a brain is sluggish in the way it makes proteins, the way it makes serotonin, norepinephrine, dopamine, and the way it surges for performance and relaxes during sleep, that insulin mutes all of that. High levels of insulin take it to it's not human. It's not what human brains are meant to do. It's this tiny little range of function that their brain can still do. And as we restore their metabolic health, the range of function is the best part of what happens in a ketogenic diet, is that peak brain performance, never done better than when their brain uses both fuels multiple times throughout the week. And you do not have to guess on this. It really is a season where you can measure it and just show yourself.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
If I had to put one demon out there for the chronic diseases that have filled my internal medicine clinic for 20 years, insulin wins. You can say, Doc, I want to check a fasting insulin. And we have lots of people do that. But the fasting insulin...